My name is Yash. I'm a senior down at Miracosta High School in Los Angeles County. And before I talk about what I'm sure is our favorite topic, economics and finance, I want to talk a little bit about why and how I'm even on this stage in the first place. When I was 12 years old, the first point of contact I had with the mental health care system was a police officer asking me questions about my suicidality and then having me 5150. Um, and being that young and having that experience was honestly rather traumatic. It kind of made me scared. It made me wary of the mental health care system. And as I progressed through it, as I went to RTC and IOP, PHPs, these intensive treatment programs, I began to almost see a different side of the mental health care system. You see, I thought into it when I was entering that, oh, this could be a place where I can work on myself, where I can get better, and where I can learn. And what I learned was, as with these kind of more intensive programs, oftentimes it's more of your existence being reduced to a treatment plan or you needing to check off these treatment goals. And as I've been talking, I still have a lot of friends from my time in these various treatment centers. And as I talk to them, a resounding piece of feedback that I've heard is, you know, I think I needed the stability of this center. I think I needed this specific therapist, but I'm not sure if I needed the experience that came with being in that center. And that got me thinking. I was kind of wondering, oh, how do we create that stability, but also, give students a center where they can, better themselves and all of this. And as I was thinking about it, I was like, wait, what if we had a solution where students didn't need that stability because they already had it? And that's when I learned about allcove and the allcove model. Um, I was initially a part of the Beach Cities Health District Properties Committee. Um, the Beach Cities Health District is going to be the public health services authority that oversees Alcove as well as several public health programs. And part of my work on the Properties Committee was going through each program, looking at their finances, looking at all of the stats, and kind of figuring out a way to make all of our programs sustainable so that the district could recover. When I first joined the properties committee, it was 2022, right after COVID-19, where we had seen serious losses. And we saw Alcove and we saw the mission, and we strongly aligned with the mission. We thought, yeah, kids need this type of thing, but how are we going to make this financially sustainable? How are we going to not put ourselves in even more red and even more financial jeopardy, but at the same time help these kids? So to begin, I want to talk a little bit about what Alcove is, what the Alcove model is. The whole concept of Alcove is for youth, by youth, meaning we, the youth and the youth advisory group, which I became a part of, design everything from the actual design of the facility, our color palette, our furniture, our what artwork we show on our walls. Decision making, talking about what groups we want to make, what policies we want to promote. Do we want to share this pamphlet or do we want to share this pamphlet, etc. Marketing strategy. So going out and kind of establishing an Alcove brand in our communities, policies and procedures, advocacy. That's things like this, where we talk to all of y'all, where we share what our mission and model is, and outreach and recruitment, going to schools, getting the word out, all of that sort of thing. Like I mentioned, I'm a member of the Youth Advisory Group, and we are young people ages 16 to 25, though I believe all of us are in high school, collaborating to educate and empower mental health treatment and mental health services in our communities. We've had 4 cohorts of All Cove Beach Cities. We opened in 2022, so our first cohort was from 2021 and so on. And we've done over 3,000 hours of service for our center. In terms of our successes, since our opening, we've had more than 14,000 visits from young people, with nearly 1,700 enrolling in a service stream. When I say a service stream, allcove has 6 core services. It's going to be mental health care, physical health care, supported education and development, uh, family health care, family support. Um, I mentioned physical health care. Yeah, as well as group healthcare, so kind of getting a social aspect going, and education, career services, those sorts of things. We've had over 4,900 mental health visits, with more than 800 enrolling in a service stream from those visits, more than 1,700 community engagement touchpoints, prioritizing financial stability through collaboration, advocacy, and we've had a remarkable amount of kind of more tangible aspects of our success. I know I was just checking our stats yesterday. Just yesterday afternoon, we had 2 safety plans filled out. That's 2 students that we intervened who were showing signs of being a safety risk, and that was just yesterday. In the last month, it's been somewhere around 10, 12 students. So that brings me to our favorite subject again, finances. How do we cover all of this? How are we going to continue to cover all of this? Well, as you can see, I understand y'all were talking about acronyms. We have quite a few. With our state, we have a number of grants from the Commission, from the Department of Healthcare Services, from Healthcare Accountability. Um, on the federal level, we have grants from the Drug Free Communities Program and the Community Project Funding. And on the local level, we have agency support from the Beach Cities Health District, which is again the public health agency overseeing our area, as well as the Los Angeles County Department of Mental Health. So it looks like we have a lot of grants going on. It looks like, oh, they're doing okay. So in reality, what we're doing is we're breaking even. And that is a problem because, in the way that our healthcare system is, in the way that our country is, breaking even is not a sustainable model. We can't just make the minimum amount of money to run our center, because what happens if something big happens, if there's, an unexpected expense? And lo and behold, we have an unexpected expense. The 514 building, which is the building we are housed in, is going to be demolished because it isn't up to certain earthquake codes. So now we have to find a new center, construct a new center, and that is going to cost $12 million. 6 million of those dollars have been generously granted to us by the county, which means we're left to find $6 million. And like I said, we are not making significant profit. So, what's the point I'm trying to make here? What I'm trying to say is this: we have all of these systems in place that have been going and promoting mental health and, helping the communities. But at the same time, a lot of that money is reactionary. A lot of that money is going to the RTC programs, going to the IOP programs that I went to, programs that honestly leave, in my experience, seeing a vast number of my peers leave students feeling as though, it was only a specific aspect that helped them. And even today, these centers have waiting lists that are months long. So it's clear that we need to cut off the problem more upstream. We need to cut off the problem with something like allcove, something in the community, something that is able to help a vast array of students, something that is accessible on many levels, and something that kids want to go to. It's much easier to say, hey, let's go to allcove, let's go do our homework in the cove, because the cove is a nice spot. You can hang out there. And then from there, it's much easier to get enrolled in a service stream, to be able to get these students help. Um, and honestly, that's what I love most about Allcove is the community approach, the ability, our unique ability to meet students where they're at, instead of telling them, okay, I'm gonna send a cop to you, or okay, go talk to the emergency room physician, because that's just not acceptable anymore. It isn't okay for a kid whose first experience, with the mental health care system It's not okay if it's going to be a police officer. It's not going to be conducive to care, conducive to the feelings of safety if these students are, you know, their first interaction is one of fear. And that's exactly what allcove tries to combat by being in the community. But as I was saying, a lot of that money goes to the reactionary programs. We're already at a disadvantage because we're a preventative health program. We're trying to get students to come to us before a crisis occurs. So that already limits us. And then from there, we usually get money to get started up. We get some grants, drop-in centers, we get money from community project funding, and these help us get going. But once we're established, as we have been we just had our 3-year anniversary, the question becomes a little more difficult once those grants, start to be used up. Where do we go from here? What money can we use now? Um, so the point I'm trying to make in everything I've said, I know it seemed a little all over the place, but the general point is this. If we want to create a mental health care system that is effective, that helps students at every level, a major aspect we need to start thinking about is preventative health care, of maybe not mental illness treatment, but mental wellness treatment, teaching people how to, turn off their phone for a little bit, go outside for a little bit, talk to their friends a little bit. These aren't things that are tangible that we can measure and say, oh, okay, this student received comprehensive mental wellness support from Alco. We can't say that. But it is vitally important. And I personally believe that should we get those services to more students, then we'll be able to cut the problem off upstream and severely aid our friends that are working tirelessly, that have these months-long wait lists in the reactionary side of things. So I think we need a major focus on prevention. I think we need to follow through on these efforts on prevention. We get them set up, we keep them going, we do research, we see how is this actually working in the community? What are people using us for? And thus far, I'm proud to say that I think allcove has been a success. Even those 2 safety plans yesterday proved to me that it was a success. I believe that's the end of my time. So I appreciate you all for listening to me, and I hope I provided some guidance.